Well, Dr. Mahoney, it looks to me that you probably too, based that you use, natural cure and stuff like that a lot, that you also use hormone replacements. And hormone replacements, nevertheless, there's a tremendous amount of different opinions. Some say it will, I don't know whether they say it will kill you, but it will hurt you. It's not good. Some say it's super expensive and it's only for the Julia Robertson and the Tom Cruises of this world. Again, as I said, some say that it will inhibit your own body to produce hormones, and thus you're putting it on crutches, and we know that that's not good to have crutches on your life for a lifelong. So can you shed some light on it?
Sure. I think the things that you're saying are very common misconceptions, and I would say about the deadliness of it, that, oh my, you're going to die if you take hormones. The fact is that if you take testosterone replacement as a man, yourself, me, whomever, if you take testosterone when you don't have enough, your likelihood of dying is twice less likely. So the death rate from not having hormone replacement with testosterone, if you're low, is double. From heart disease, brain disease, whatever. But it has to be a healthy type of testosterone. You can't use synthetics. And when you hear all the literature or the data or the buzz or the mythology about, hormones are going to cause cancer and kill you, your risk in some cases is slightly increased, but the benefits are enormous. So someone who takes hormone therapy that's properly given and properly evaluated and monitored, they're going to extend their life significantly, and not only the length of their life, but the quality of their life while they're doing it. And in terms of it being a rich person's game, human growth hormone, yeah, that's a rich person's game. That's $600 to $1,000 a month or more. But very few people need that. What they really need is good, judicious use of thyroid, some sex hormones like testosterone, estradiol, progesterone especially. I love that because it's very, very safe. There's virtually no cancer risk with natural progesterone, where synthetic progesterone is a known cancer-causing agent. And most prescription drugs use synthetic progesterone. Not all, but most. So these synthetic drugs are ones that are derived from animals that are not like human. They tend to cause problems. Bioidentical hormones, which is what we use almost exclusively in the practice here, are known to extend life, reduce the risk of serious disease, and in every way make you feel significantly better when they're properly applied. So there.
Here we have it.
Yeah.
So obviously, it makes lots of sense. I'm a big vitamin taker, and I have seen actually what I think are very misleading studies by the drug industry mainly, and they go and say, well, look, we proved that vitamin E doesn't do anything, but they use synthetic vitamin E.
Yeah.
And also probably
exactly right.
Not enough. Plus, they mix it up with some other drug with it, and they say, see, it doesn't work. That would be, that would be like me saying, look, having a healthy sex life improves your marriage. It's a wonderful thing. And I go, see, it didn't work because, I went out and slept with 25 prostitutes, and it didn't help my marriage at all. It's like...
Yeah, I don't think that's the idea.
Yeah, that's not the idea of having a healthy sex life, right?
No, I wouldn't call that healthy.
Yeah, so I think that, so basically what you're saying is number one, those things need to be natural. And are they oral? Are they injections? Are they topic?
Great question. Well, the big issue with all of this is that your body uses hormones in certain ways that are very healthy for it. If you take estrogen orally, if you put a pill in your mouth and swallow it, it makes the estrogen, it deforms the estrogen. It acts funny, and it does things to your liver, and it does things to the estrogen that are not good. So with estrogen, we almost always give it either through the skin with a cream or under the tongue in a drop, or, this is just breaking news and very valuable, you put it under the skin in a pellet, which lasts 4 to 6 months depending on the individual. Testosterone the same. You don't want to take it by pill. You can inject it, but as you probably are well aware, injections hurt. So we don't use injections much. We use testosterone cream and lots of pellets. Pellets are FDA approved for use in men who have low testosterone levels, and they work great.
But aren't the pellets, if it goes under the skin, don't you need to inject them also?
Well, what you do is you give a little bit of numbing medicine in the hip, just like a dentist puts in your tooth, so you don't feel it when you slide that little, it's like a fat syringe. You slide under the skin and you put the pellets under the skin with that. And dramatic difference in the sense of well-being, in sexual function, in every area of life that typically you can't fix that yourself. You can't muscle your way through it. I'm going to go to the gym and work out and get my testosterone level up. That doesn't work usually. You need to have support and supplementation with testosterone through the skin. And our experience with it is that we have men lined up kind of knocking the door down to get their treatment because it just totally revolutionizes their life. So,
okay. So give me a small example of advantages or disadvantages of doing the testosterone and do it into the skin or whichever way, then you make it correctly versus that blue pill they call Viagra or something like that.
There's a total difference because when you look at, I'll start with the top drawer. The very best way to supplement testosterone, in my opinion, is to take natural substances that boost your own testosterone, if you can do it. It doesn't work very often, but when it does, that's the best. We use them.
Let me interrupt you. What would that be? I mean, because
we use a red crab extract called Genesis, and you take that and it blocks the enzyme that converts testosterone to other medicine or to other compounds in your body. So when you block it, the testosterone builds up and is much more effective in your body. You get a much better level. So that's a red crab extract that we use called Genesis. The other that I would recommend, though, is beyond that is there's a thing called Chrysin. Chrysin is, you can use it in a cream, and it blocks that same enzyme. It's much more readily available, but I don't think it's very, very potent. So what we almost always have to do eventually, as men get less and less capable of producing enough testosterone to support real high-level function, is we tend to supplement it, either with a pellet or a cream, but pellets are the best because they're so convenient. You get it done once, and then you don't have to do it again for 4 to 6 months, depending on your levels. So it's very, very easy. You're not putting on cream every morning or drops under your tongue, which tastes nasty anyway. So you don't do that as much with testosterone. And they're natural testosterone. It's not a methyl testosterone. It's the same kind your body makes. So it fits the receptor in your body, in your brain, in your heart perfectly. And when you go to work out, your recovery is faster, so you work out more. You tend to be less sore. You tend to build muscle better. You tend to not convert your calories to fat, but to muscle. So it's a gigantic benefit. And I think any man who has any symptoms of depression, lack of motivation, sexual dysfunction, lack of recovery after working out, any of those things, grumpiness, sleeplessness, all of those can be exquisitely responsive to testosterone if they have a low level. If their levels are normal or high, it's probably something else. So you need to have that checked by a doctor, have it looked into carefully, and have a very qualified, experienced doctor monitor all of that so you get the maximum benefit for all that you're doing.
Right. Now, we haven't talked yet about that blue pill. So you talk now about
Viagra.
So now talk about that other one of what that does or doesn't do, or even hurts if it does.
Well, I think Viagra, Cialis, all those kinds of medications, Levitra, we will use them occasionally in the practice. They have more to do with blood flow than they have to do with testosterone level. If you can replace testosterone and get the benefit that you're looking for in terms of intimate relationships and sexuality, that's by far a better choice. 50% of men who have problems with their sexual function are having heart disease at the same time. That's one of the first signs of heart disease, is erectile dysfunction. So if you don't pay attention to that and you just treat it with Viagra or something like that, you've missed the boat again. The stop sign comes up and says, hey, you need to stop and pay attention to the heart. So anyone who comes to me with that kind of complaint always gets a stress test. So we look at their heart, make sure it's okay, and if they pass that test, then we'll look at maybe giving them something like Viagra or Cialis. But first, testosterone, because that's natural, healthy production of the body. Sexual dysfunction is not a Viagra deficiency. Sexual dysfunction is a problem that's global, emotional, testosterone, and possibly they need that medicine. And for men who need it, I don't see any reason why they shouldn't take it once everything else has been exhausted.
Once everything else has been exhausted, I think is one of the, at least would be a key word to me. So that's, so your person takes the testosterone and it goes up and all the stuff we just talked about get better. Is there any other, beautiful side effects such as, better glowing skin, skin tightening, looking younger? I don't know. I mean, anything else?
Keep going.
What?
Keep going. You got it right. Yeah,
really?
your skin your skin quality dramatically improves. Vision improves. Timing, in terms of, there was a study done at, I'm sorry?
Vision improves, huh?
Oh, yeah, vision will improve because the muscles in the eye are improved.
Maybe I can throw away my 99-cent glasses for reading?
Yeah, you might be able to. I wouldn't throw them away just yet.
No,
First, come get pellets.
But they're expensive, 99 cents. You don't just want to throw them away, you know?
Yeah, I'm with you there. But I think that if you think about all the other peripheral benefits, if you think of testosterone in a young man, they run a level of 800 to 1,000 or so. In an older man, as they age, they lose 2% per year from the time they're 40 years old. So each year that goes by, they're a little less and less and less capable of producing testosterone. If you replace the level to where they're back where a 30-year-old man is or a 25-year-old man, they get many of the same benefits of youth. In other words, their skin looks better. Their skin is more, the tone is better. Their muscle tone is better. Their ability to work out and build muscle is better. All those things that you think of with a young man, when you say, you look at a young guy, you can tell they're young. Their skin's tight, they look good, they're healthy, they're vibrant, they can work out. Many of those same qualities are restored when testosterone replacement is properly given. So I think there's way more than just the longevity benefit, which is significant, like we talked about before. Double the death rate for men with testosterone levels that are low. So it's a matter of life and death sometimes, but it's also a matter of looking good and feeling good. So it hits the whole spectrum of everything. It's global in every way. Yeah. So it's a great treatment. I love doing it. It's a blast. And people are so benefited by it. It's very gratifying.
You must have lots of good friends helping them with all that good stuff.
Yeah, I'm popular sometimes.
Looking good and feeling good. That's great. That's great.
Yeah.
That's great. Well, thanks a lot, Dr. Mahoney.
You're welcome. It's great.